Hi everyone, welcome to Center of Balance. I'm the fertility acupuncturist Phua from Center of Balance. Right, today our topic is female infertility treatment. Now, you may have been following me for a while. Um, if you do, then you know what I'm going to ask you right now. I'm going to ask you to say hello to me. Yes, say hello, Sunan. How are you? Good morning. It's 7:06 today. So I'm gonna keep it for half an hour today because I have an appointment to see my patient at 8 o'clock. Um, Further on, we're gonna probably take two parts. So today is first, number one, part of female infertility treatment. We're gonna talk about. Then tomorrow we're gonna ongoing for the second part to talk about female infertility treatment. Okay. Now in this topic we're gonna cover Western medicines, Western treatment, Western medicine treatment, and acupuncture, and some of the Chinese herbs. Okay. In acupuncture, we're gonna talk about how it works, and we're gonna talk about if you're an acupuncturist, then you're going to receive some acupuncture point. What we use in our clinic, what is the strategy we use for infertility uh, treatment for female. Now, when it comes to treatment, we call it narrows to some different disease, like PCOS, what is strategy, fibroid, what is the strategy, and endometriosis, what is the strategy. Okay, so we use this um, different strategy for different causes of female infertility. Does it make sense to you? Right? If you're following me for a while, then you like my video, please give me a thumbs up first and share this live video on your social media. Right? If you're on Facebook, please share and even tag as well. Tag your friend in. And if you're on what you call Instagram, you can like, you can say hello, you can share as well. If you're on YouTube, simple. When you finish this video, or say hello to me and give me a thumbs up is something that I hope you can do for me. And on YouTube, when you finish this live video, take the link and share on your Facebook, Twitter, whatever you can on social media. Does it make sense to you? Will you be able to help me with that? Hi, Veronica. Good morning. I'm doing well, thank you. Happy day. Good morning. I'm very good, thank you. Eric, hi. How are you? Veronica say yes. I like every talk you give. Thank you very much. Thank you for supporting. Every morning I see Veronica, Eric, happy day, and Joe sometimes, right? But thank you very much for your supporting. Your supporting keep me going. I appreciate that. And give me a lot of feedback as well. Thank you, thank you, thank you. Now, just checking the other platforms working. All right. All good. Now let's start. If you're watching the replay, you can just fast forward, but about 3 minutes, 5 minutes, or even up to 10 minutes sometime, and then you can choose the speed to let this live video speed up faster. Okay, then you don't have to, you can finish it much faster. Okay, infertility treatment. Now, if a patient, a couple, has been trying to get pregnant and haven't been able to, right? Then you may wish to seek treatment, right? And the type of treatment that recommend can depend on a variety of factors. So what is a factor? That includes the cause of infertility, if known, right? Why we say if known? Because um, according to fertility specialists, right? As I mentioned again and again, they are not really relying on uh, uh, the symptoms that patient feel, like PMS. In Chinese medicine, is very in fertility acupunctures, we focus a lot on the patient feeling. The patient feel pain all the time. The patient feel pain before period, and that could be the no. Why? First idea is we are trying to increase the fertility rate, the conceive rate, conceivable. So every woman is conceivable. Now you have this idea first, okay? This is natural. Now, if you have symptom while you have period, or before period, or after period, that's abnormal. When you have those symptoms, which means your conceivable chance, your fertility rate is getting lower. Let's put it in here. If you have symptoms while you period, before period, or PMS, the symptom increase in here. Then fertility rate is going down, right? This is the scale. Now, if those symptoms decrease, mean the fertility rate going up. Right? This is in a fertility acupuncturist mind. You have to have this mind. Why is that? Because this is very different with the Western doctor. In the Western medicines, they don't care so much about the symptom. If they do, they will do something for it, but they don't because they can't do anything for it. When I say they can't do anything for it, is particularly for pain. If pain, they really can't do anything for it. Painkiller, painkiller, painkiller. That's the only thing that covers the symptom. We're not doing this. We have acupuncture, we can cover the symptom, but we have a strategy. The strategy is if the patient here with pain, we cover the symptom as well as treating the root. Now, out of the period of PMS symptom, we treat the root rather than doing the needle for the symptom. So we have two different strategies. One is treating the root. The other one is treating the symptom, right? Now, in a Western doctor, if you have pain, you keep suffering from pain, discomfort while you period, and there is no endometriosis, and there is no other underlying cause they can find, then the only thing that they give you is painkiller. And what is the painkiller going to do? Cover the symptom, which we can do with acupuncture without side effect or Chinese herbs. Okay? Now you have to have this mind. Then we say, well, the cause of infertility, if known, if we know, or if the Western doctor known that the cause of infertility is from endometriosis, and endometriosis causes pain, then they will do something for it. But if there's pain and there is no endometriosis, no PCOS, nothing at all, then what they can do is only giving you painkiller, cover the symptom, and they can't treat anything no further because there is no diagnosis, right? So I keep saying to my patient, if there is no diagnosis, even in, doesn't matter whether it's in Western doctor or Eastern method, in acupuncture and Chinese medicine, when there is no diagnosis, there is no treatment. There's no treatment principle, right? So that's important. A diagnosis is very important. So a diagnosis in Chinese medicine, it can be very different to the Western medicine because we have a different system. We have different theory when it comes to human body, right? So you have to recognize this. And when it comes to treatment, we're talking about treatment today, and it's very different because our diagnosis is different. Now, if you're a patient, you've been diagnosed and no reason of infertility. That is only in Western medicine. If you have any sign or any discomfort while your period, or just in general, that can be this reason that causing you infertility. So we are much focused on lifestyle. We are much focused on the general health as well as your period when it comes to infertility, right? And for the Western, they just much focus on period or infertility, and the general health. They don't so much care about those. Now until they have a direct link to infertility things, right? Like thyroid, it's been proved. Everyone know that. But if there is high blood pressure, they don't so much care about that. But we do. We do. If there's insomnia, they don't care about insomnia that link to infertility. Right? If you have diarrhea, if you're bloating, as long as there's no endometriosis and there is no PCOS and there's the hormones all good, and they don't care about the diarrhea or constipation. But we do. We do. That is the bigger difference. Can you see that? So now it all depends on how long have you been trying to conceive as well when it comes to treatment, okay? And how desperate, and your age. If you're 30 years old and or you are 40 years old, it's totally different strategy of treatment, right? Let's say if it's 27, 28, and you found out that it's been 2 years or 3 years that you keep trying, that you haven't conceived yet, that if you're 39, 38, 39 years old compared to 39, 28, 29 years compared to 39, totally different. 39 is going to close to, the egg of quality is not good. It's no longer better than when you were 28, 29. So the strategy will be very different. Okay. So for example, if it's fibroid, right? If a very small fibroid in 39, our strategy would say, well, if on 39, we will suggest you get surgery and clear it all out. If a small one. And on 28, 29, you still have time. We might just suggest using Chinese herbs and acupuncture to reduce it, to absorb it, and then get a natural health, natural pregnancy. Right. So if it's 39, then we may suggest the quicker way is get a surgery, remove it, and then start the journey of fertility treatment. But it's so different, and of course, this is something that option that we put in front of the patient. The 28, 29, you have option to get surgery as well, but there's no need to. Right? That's because time is running out in 39. So there is different strategy for it, and we suggest to the patient, and the patient make the call, not the practitioner. Never make the call for the patient. And if you're a patient, you come to see me, I'll give you different option. I'll tell you, and this option, what would happen, what would you expect, and this option, what would you expect, and the time frame. Does it make sense to you? right? So there always a lot of other things, getting one thing done have a different way. It never come with just only one way, right? Keep in mind that, right? The overall health of both and your partner, okay? Yeah. If you cancer, very different treatment, you know. Uh, if you have serious health issues, then it may come to uh, your option may be very narrow, just one or two, okay, or just mainly just one. Maybe doing cancer treatment, chemotherapy, you're gonna kill your eggs, you're gonna kill your sperm. There's no way. The only way we would suggest you to do it is get your sperm and eggs out and get frozen embryo, put it in the frozen embryo, and then do IVF afterward. Right? And that really come to, depends on what kind of serious disease that you suffer from. Does it make sense? So as an acupuncturist, fertility acupuncturist in Chinese medicine herbalist, we we need to know all this. You can't just force a patient to do what you want. You have to let patient know what is your option. Okay, and everyone is different. Everyone case is different, right? And we can discuss it case to case. The personal preference of you and your partner, following consultation about your treatment options. Yeah. So how you decide is up to you. Okay, as a patient, right? You have to consider about your financial, your time frame, and whether you can accept the treatment or not. Some people just don't want IVF. Some people think, yeah, I don't care about that. I want IVF. Some people try to avoid it. Some people say, I only want natural conceiving and natural birth. I don't want any chemicals in my body. Very different. And some people come with acupuncture treatment, and we provide it. Some only wife want the baby and not the husband. Some the husband want it and not the wife. In all cases happen, right? So we as a practitioner in here to guide you, to give you option, the treatment option, what you can to help you diagnose and give you no diagnose, no treatment. Once diagnosed, and see what this is something that you can do. There's something I can help you. Different way. Which one would you like to go with? Does it make sense? And we'll give you the cost of the treatment as well. Yeah, that remind me. I would like to talk about the cost of treatment one day about infertility, right? So this is important. Okay, now the treatment for female infertility can also involve surgery, medication, and reproductive assistance such as ART. Right? Sometimes several types of treatment are needed to help address female infertility. Now, also, like what sort of treatment? There are a lot. The IUI, the cormorant, there are a lot of different treatment. Okay. Although surgery can sometimes be used to treat female infertility. What kind of surgery? Keyhole surgery. Okay. It can treat the endometriosis, right? And it can treat the fibroids, the surgery. Okay. So this is used in here, but not PCOS. PCOS, we don't use surgery, right? So you need to have a clear idea of what's going on with the disease, the causes of infertility, then what surgery for, right? It has become rarer now due to advancement in other fertility treatments. Surgery can improve fertility by correcting an abnormally sharp uterus. Wow, this is something that Chinese medicine can do, acupuncturists can do, right? Correcting an abnormally shape of uterus. The uterus strap is, a bonnet way, or somehow, it um a drop down, but and the surgery is the option for it. In Chinese medicine, if it's dropped down, then we can take herbs. Yeah, if it's born that way, and I don't think Chinese. Personally, I don't deal with those cases. Okay, maybe some other acupuncturists have experience. If you do, please let me know that. Okay, and I haven't come across with any structural uterus problem that I give treatment and successfully. I haven't got that idea yet. Okay, unblocking fallopian tube. Yeah, surgery can do that, and or they put the fluid in and push it over. It can help with that. Certainly, yes. But unblocking fallopian tubes, not just surgery. Surgery is not the only options. Chinese medicines and acupuncture, both combination are great for fallopian tubes blocking. Yeah, it can unblock it. Right. Removing fibroid. Yet removing fibroid is one of the case for surgery. Okay, especially for what? For the silent or the very severe one. So if it's very severe one, and it has been proved, we've seen it a lot in our clinic and in my master as well. If you clear the fibroid through surgery, it actually helps the patient increase the fertility chance, fertility rate. Why is that? Because it's blockage. It's a clot issue. It's a mucus issue according to Chinese medicine. And you take a while because that blockage it built over years, 10 years, 20 years. And you want it's a result of the imbalance of the body. Okay, it built up, it's stuck all together, right? So cut it, separate them, and actually certainly help the blood flow going better. Okay, then this is not the only treatment, to be honest. If not very severe, then we use acupuncture. It can help improve the circulation. It can help decrease the pain level, and again, the pain level decrease, and people become warmer, and the fertility rate conceivable chance increase. Okay, that is something we would like to see with acupuncture, and we help them as well with endometriosis, right? And with fibroid, if it's a small one, and you need to see what the position is. Some position are not really important. If it's on the side, it's not preventing that to conceive, and that's fine. Implantation, that's fine. But we don't want it to happen. If we can remove it, we remove it. Okay. Suggest patient for surgery, and according to the age as well. If it's a small one and they're young, not to worry about it. Get Chinese herb acupuncture because it can help it reduce, or it can pass it out. It can pass it out too. Okay. And how do you pass it out? Normally it's through your period. If you got period that time, then you can do some acupuncture before the period, and it can help and pass it out. Okay. Okay. Reproductive assistance can involve methods such as intrauterine insemination, which is IUI. Okay. And ART. During IUI, millions of sperm are injected into a woman's uterus. Okay, near the time of ovulation. Okay, this is something that you need to know when the sperm go into the body, female body, and it need to swim up. And some of them they don't have lack of energy, and halfway they stop. Can't go any further. An IUI is get the sperm and put it into uterus and inject it into it. So the sperm doesn't need to save a lot of energy for the sperm. Save a lot of energy for the sperm. Okay. So this is the way that they do it. An IUI. Okay. An IUI. An IUI can you can do it in the hospital, like fertility clinic, or you can do it yourself. They are self-help kits that you can, you can check online. The self-help kits, you can do it yourself at home. Just get the man ejaculate into things, lookup, and then the lookups you put it into the vagina and put it on top of the uterus, and then release it. Okay, that's another way to do it. Yes, self IUI is alternative to the um, clinic. Okay, that you can do it yourself. Okay, that's one thing. And clomiphene is a drug. It actually help you to what we call it. It stimulate the ovaries and help you to release the eggs. Okay, use it a lot for PCOS. Okay, and some people they have unknown reason for infertility, and they use that too. They use that too. Use clomiphene too. Now, clomiphene have side effect. Not everyone get it. I personally don't agree with clomiphene, but I understand how clomiphene works. Clomiphene, well, has been proved. It keep changing the name, and some baby it affect the baby. Okay, with clomiphene, and some get problem with baby born with baby with no hand, things like that, and not exactly the clomiphene, but the previous herb, previous drugs that happened with that. And the clomiphene, a lot of people suffer from this thing. Vaginas in the ovulation time, it actually produce mucus. The mucus is actually helping, on the egg white mucus. It actually help the sperm. It create a an environment that is super for sperm to swim and let the sperm live for longer, right? In the uterus. But the thing is, clomiphene. When we have clomiphene, a lot of women experience that they no longer have the cervical mucus because it dry up the cervical mucus. They get drier in the vagina, and that doesn't help the sperm. Dry environment doesn't help the sperm to survive, to live, and to swim, because those mucus is helping the sperm to swim up to the body, and very good one. Okay, especially egg white, creamy egg white. Those very good. But clomiphene has a side effect of a lot of people get. Not everyone. A lot of people get dry uterus. Does it make sense here? Okay. Now, here, then IVF is one type of ART, okay, and involves to remove eggs that are fertilized with a main sperm in a laboratory, and after fertilizations, the embryo, so it get the eggs and sperm together and fertilize and then into a embryo, and then after that they take there are two things. One is fresh embryo, which means they put eggs and sperm together, and they have to look at it every day. Then see whether they from 1 cell to 2 cell to 4 cell to 8 cell, something like that, and will it develop successful or not every day. When it's good and develop to the side and the things that we need, it required, they can straight away put it into your body. And normally they won't do just one. They probably collect as much as they can, depend on how many eggs. Okay, if they have 8 eggs or 5 eggs or 2 eggs, some just get one. Okay, so stimulate the ovaries and get it and get something released and take the eggs out. You know, it can take a few. Okay, then they put it with the sperm, and if you find them, it may just develop as just one, or two, or three. Lucky you get 4 or 5. You don't know. It's a gambling things. Okay, and if you have 3, let's say if you have 3, you get a 5, and only 3 develop to the side that you need, and they will suggest the fresh one first. Now, normally we just do 1 embryo a time. There are countries do 2 or 3 a time and end up with twins, you know, and we don't agree with that. Just once, okay, and we normally do 1. In this country, in Australia, we do 1. So 1 embryo at a time, and you can do the fresh one the first time, and if it's unsuccessful, and those 2, that's frozen them, and then if unsuccessful, you can do another one, frozen one, and it's unsuccessful, you can do another one. If it's successful, then you can keep those 2 and you keep paying for them to frozen. Okay, and after 1 year, the baby born, if it's successful, and 2 years or you're ready for another one, then you go for another one and you use the frozen one. Does it make sense? This is IVF. Okay. So the medication used to treat female infertility work like hormones that are naturally present in the body to either encourage or regular ovulation. Okay, so yeah, with IVF as well, IVF can do 2 things. One is natural cycle, which not involve any drugs. You just take the eggs out, sperm, and put back the embryo according to your cycle, right? Following your cycle. But the other IVF is they keep monitor your uterine lining, and they monitor your hormone. Okay, if the hormone not there, not reaching what it's supposed to be, and they'll give you drugs. Cancel the cycle, and the next cycle, do the frozen one. They give you the drug, injection, taking that, and then transfer the embryo into your body. Right? This is it. Okay. So today we only have time to talk about the Western medicine treatment. We're not covering very deeply. We just go for what if this, what can we do? What if this, what can we do? With PCOS, and they normally do IVF, to be honest, and they may do chromosome first, and it's not working, then IVF. With fallopian tube problem, surgery. Okay, there's some Western side, but again, in Chinese we can do in Chinese medicine side we can do acupuncture in Chinese herbs. And what else? Fibroid, again, we'll talk about that already. If it is a fibroid, if it's a small one, we can use herb to resolve it, and acupuncture to help it. And it's a very big one, we suggest surgery. Okay, according to Chinese medicines. It depends on the age as well. What else? Endometriosis. Endometriosis, we use acupuncture in Chinese medicine to treat it. You know, if everything symptom subsides and you keep trying for 3 months or 6 months and nothing happened, then we suggest surgery. This is what we're doing. This is strategy. But what exactly the strategy, the method that we use, we can discuss in the next video. What else we normally see? If an infection in the pelvic area, then acupuncture Chinese method. And you, in the Western side, they may ask you to take drugs. Or if it's kidney infection or bladder infection, yeah, taking drugs. in Western medicine. They can't do anything about it, apart from drugs, antibiotics. For us, different. We treat the root. We use Chinese herb, we use acupuncture, and it works very well. What else? Let me think. What else do we want to know? We're talking about big topic, and my wife's 40 years old and she has fibroids. She says she is scared of surgery. I've been trying treating her with acupuncture, but there is no coming the way I was expecting. How can I? So you need to tell us what have you done, you know. So if you have been treating, if you're an acupuncturist, the fibroid has stopped her period. The fibroid stopped. Then you need to let us know how big is it, and where's the area, and what have you been treating it. So if you're an acupuncturist, you tell me a case, you let us know a case, then you need to let us know what have you been trying, because I don't want to suggest the same treatment to you. You get me? Yeah. And how often do you treat the wife, and what method have you been using? And apart from that, what have you changed in your lifestyle? What have you, all the treatment, you need to let me understand it. Then we can give you other strategy and give you other advice, and to guide you to have a new strategy to do the acupuncture or other treatment for your wife. Does it make sense to you? So I don't encourage my patient or my colleague to just tell me to seek the answer. If you have the treatment, you need to provide the information, everything about the information, right? And bear in mind, we here online. I don't see your wife, I don't see your patient. If you want to ask all those questions, you take the responsibility. I can't take the full responsibility for the patient. You are the only one take the full responsibility for your patient. Okay, you have to be smart that whatever we suggest in here, and you need to choose the right treatment for your patient, because we don't see your patient. You are the one who see your patient. Does it make sense to you? All right. This is about the Western medicine that I understand about it. Quickly, just for half an hour that we talk about this, and it's not everything, to be honest. It's not everything. It's something that in my mind that I share with you, and we can talk deeper when it comes to that. When we go to, let's say if we talk about PCOS, we can talk about deeper in here. If we talk about fibroid or endometriosis, how we treat, we can talk about deeper. But tomorrow, I'm going to give you acupuncture and Chinese medicine for female infertility. And I'm going to show you some point that how you treat it, okay, the point, okay, and some strategy in Chinese medicine and acupuncture point as well. We're going to talk about, and we're going to talk how acupuncture and Chinese medicine can help all these symptoms, and what is the theory behind. Okay, does it make sense? Today we only cover Western medicine. You need to understand how Western medicine treat that. Get some idea, and in the future we cover deeper. Okay, today is just touching a bit, introducing Western medicine, understand Western medicine. Okay, all right, that's it for today, and stay awesome, and I'll see you tomorrow. Bye bye. I better go because I have 15 minutes. Drive to my clinic, 5 minutes. Then my patient will arrive at 15 minutes. Thank you very much. Stay awesome.